Hi, my name is Allison Gifford. I'm a nurse practitioner that works with Elite Patient Care. I am the Director of Quality and Compliance, and I'm also the EPC super user for Dolby Fusion Narrate. Chances are if you're watching this video, you're interested in voice dictation software. What I plan to do during this time is do a demo of what it looks like when I input a patient encounter. I'll then briefly pause the video, reopen the recording, and then show you some additional features with Dolby that I can't demonstrate while I'm dictating a patient's chart. So I'm going to start with patient Mickey Mouse and just show you briefly what this would look like. Encounter for hypertension, atrial fibrillation, osteoarthritis, period, reports new onset insomnia. Mr. Mouse is a 99-year-old male with a past medical history of CAD, CKD, diabetes type 2, hypertension, atrial fibrillation, osteoarthritis, depression, period. New line. Today he is seen and examined in his room while resting in bed, period. New line. Hypertension is presently well controlled, period. Recent vitals have been within normal limits, period. Denies chest pain, headaches, visual changes. New line. Atrial fibrillation, currently well controlled, period. Denies palpitations, weakness, fatigue, shortness of breath, period. Nursing denies any abnormal bleeding episodes, period. New line. Osteoarthritis, intermittently controlled, period. Patient reports that he often has bilateral knee pain, period. He describes the pain as being the worst in the morning, period. Describes it as dull and achy, rates it a 3 out of 10, and states that it does respond well to Tylenol presently, period. New line. Reports new onset insomnia, period. He describes his difficulty sleeping as both difficulty falling asleep and staying asleep, period. Admission to Memorial Hospital from June 1st through June 7th, 2019, new line. Mr. Mouse was admitted to Memorial Hospital after an episode of weakness and dizziness at home that resulted in a fall without significant injury, period. New line. Diagnosis at the time of discharge, new line. 1, period, hypertension, new line. 2, period, atrial fibrillation, new line. 3, period, osteoarthritis. Essential hypertension, atrial fibrillation, osteoarthritis, insomnia, mother died of ovarian cancer, new line. Father had history of coronary artery disease, hypertension, MI. Amlodipine 5 milligrams, 1 tab POQD, new line. Coumadin 1 milligrams, 1 tab POQD, new line. Tylenol 325 milligrams, 1 to 2 tabs POQ4 PRN for mild to moderate pain, new line. Melatonin 5 milligrams, 1 tab POQHS PRN for insomnia. Review of systems. Review of systems. basic exam, intact, alert and oriented times 2, irregular, irregular, hypertension, hypertension, chronic, stable, new line, patient denies symptoms presently, new line, nursing denies episodes of abnormal bleeding, new line, continue INR on Mondays and Thursdays, new line, will continue to titrate medications accordingly, new line, maintain bleed precautions. Maintain bleeding. Chronic, stable, new line. Patient reports pain is well controlled with Tylenol presently, new line. Continue to encourage out-of-bed activities, participation with physical therapy. New, stable, new line. Will try melatonin 5 milligrams, PO, QHS, PRN for sleeping difficulties, new line. Will continue to partner with patient for symptom management versus side effects of medications, new line. Need to be cautious of sedating medications due to patient's weakness, history of falls. So that's basically what it looks like when I input a note using Dolby Fusion Narrate. And now let me show you a few other things that Dolby can do. So Dolby has the ability to make it so that you can open a new window and select items. So for example, I created a shortcut for labs, and this is what this would look like. Basic metabolic panel. At this point, a lab would open, and I can then use voice dictation to input the values. 140, 5, 110, 22, 16, 1, 70, 9. And then you can insert it that way. I've also created one, for example, if you had advanced care planning that you were trying to do with the patient, you can create a plan in Chartpath, and then all you have to do is say advanced care planning, 16, patient and spouse. There's my documentation for advanced care planning. Perhaps I had a patient who needed a wheelchair ordered. Standard wheelchair male. There's the documentation would be required by CMS for that. I also created shortcuts, for example, if you were doing a workup maybe for depression, PHQ9, PHQ9. This would once again open a window where you could then voice command your way through the scoring. 1, 1, etc. You click OK, and it would insert the whole scale as well as the interpretation. One of the features that is specific to Dolby compared to other voice dictation products is what they call the visual click. That's where I had earlier today showed you when I said review of systems. And it goes through and it is prearranged. This is a macro that I created which is a little time consuming, so I don't use it on every encounter, but it does save time when you have a more detailed encounter because it'll give you the basics and then you can go through and change what might be pertinent to your patient. One of the other features that Dolbey has is that they can do other types of shortcuts. So for example, in order to be able to demonstrate this feature, I created a shortcut that will have Dolbey open Teamforia, log me in, and then post an announcement about Dolbey. And this is what that would look like. Teamforia. And that was a shortcut that I had previously arranged. So some providers are able to use this to log into a lab website or other outside websites that you may use frequently. Another shortcut that was created is for MIPS codes. This opens an Adobe online document that I created for EPC use that would then list all of the MIPS codes that we're tracking so that you could just have this open in the background. Overall, there is a lot that Dolbey is capable of doing, and the potential is out there. The biggest thing is the more you use it, the more you learn it, the easier it becomes. There is, of course, a technical learning curve. Most of the providers who have onboarded with it feel that it's reasonable, that nobody's been too technically challenged by it. I hope this answers any questions that you may have had about what Dolbey looks like when you're using it. Please don't hesitate to email me or reach out to me if you have any additional questions or if you're wondering about any further capabilities. Thanks for taking the time to watch this meeting, and I hope you have a great day.